My name is Aneel Paulus. I'm an assistant professor of medicine at the Mayo Clinic in Florida. And the focus of my lab and research is on the preclinical to early stage clinical development of immunotherapy for the treatment of B-cell cancers. The reason I got into immunology is because to study the cancer cell in isolation, just by itself, is futile. You have to study its environment, its neighborhood, the people that, or the cells that it's surrounded by. And so the most effective type of therapies that I believe are going to be developed are taking that into context to be able to study the cancer cell or any other pathogen in its environment with the immune system. The most exciting topic in my field today is the development of the chimeric antigen receptor T-cell or adoptive T-cell therapy. I believe this is truly groundbreaking. There are multiple strategies now to enhance the effect of CAR T-cells that my lab and I are working on, and hopefully that should be in the market soon. The best time of my professional life has been in the lab amidst all of the chaos, hustle and bustle, and driving really to find a cure for cancer. The most important lesson that I try and instill in students and mentees that are entrusted to me and in the lab particularly are that always keep an open mind, question everything. It's the questions sometimes that we don't ask are the ones that will eventually be answered and lead to a cure in cancer, a cure of disease, and may save someone's life. One of the most important issues facing young scientists or clinician scientists is the environment in which we currently operate, the truly tremendously difficult difficulties in funding that we face and that they will face. And unfortunately, I don't think that young scientists are often given enough opportunities from institutions, agencies, foundations, and perhaps that can be better, direction can be, or attention can be directed towards that. Well, the current fiscal climate has been challenging for most researchers, myself included, but at the Mayo Clinic we've been more than fortunate enough to have private endowments, foundations that I work with. I believe that the NIH, although it is getting better, still there's a lot of progress to be made to be able to fund good research, especially early stage investigators with new novel ideas. There are several opportunities that I believe would help advance the field of immunotherapy, immunology, particularly in cancer as I deal with. And I believe those opportunities are where the interface really of pharma or industry and academia. That has always been a challenge, but I believe more as we go forward that the investigators from academic centers such as my own or others, when partnered right with or with the appropriate big pharma partner, truly our science can lead to breakthroughs in terms of therapy. The next generation of immunologists have so many resources, and there's been so much that has developed in the last 10 to 15 years in terms of knowledge in the field, in terms of tangible therapies that have been developed. And I think the next generation of immunologists truly stands to make some of the most amazing breakthroughs in the field of immunotherapy for cancer or for other immunologic disease states.